The topic of this communication is the pathology connected with the hemorrhoids and its surgical therapy. It is quite a widespread disease. About 50% of the over 50s suffer from hemorrhoids or suffered from them. This anatomical picture shows an outline of the last part of our bowel, that is the rectum, and of the anal canal. The anal canal is the very last part of the bowels and is situated for a length of about 3 centimeters above the anal orifice. The anal canal is always closed due to the action of the sphincters surrounding it. It only opens during evacuation because the sphincters relax. As you can see, above the anal canal, there is the rectum, where the feces accumulate before evacuation. Both the anal canal and the rectum are lined within by mucosa. Externally, one can find the skin. Internally, within the cavities of the body, one can find the mucosa. For instance, the pink lining within one's mouth is mucosa. On the left of the picture, you can see that the mucosa of the anal canal is different from the one lining the rectum. It is more whitish, while the one lining the rectum is slightly pinker. There is a separation line between the two mucosas called dentate line. Such line could be defined as the line of pain. In fact, the mucosa of the anal canal is rich in nerve endings, and when wounded, it causes a lot of pain. The mucosa of the rectum, instead, is not very sensitive to pain. In the picture on the right, the mucosa has been removed, and one can see the hemorrhoids under it, that are very numerous, slightly dilated veins situated in the submucosa. As you can see on the right of the picture, during evacuation, the rectum contracts and the sphincters relax to allow the feces to move through. The function of these veins, called hemorrhoids, is, as can be seen in the picture on the left, to lead out the feces and to buffer the latter, sometimes hard, and the delicate mucosa of the anal canal that can be easily damaged. Therefore, this buffering prevents wounding in the anal canal. An average evacuation should last a few seconds. At the end of the evacuation, the hemorrhoids quickly go back in situ as the sphincters close. When these veins dilate, as you can see in the picture on the left, there is the hemorrhoidal disease, commonly referred to as hemorrhoids. As this is the commonly used term, the hemorrhoidal disease will be referred to as hemorrhoids from now on. At the start, these hemorrhoids are internal, within the anus, but in the long run, as can be seen on the right, these hemorrhoids can surface externally, giving a feeling of having some fleshy formations that can be perceived outside the anus. This condition is defined as hemorrhoidal prolapse. The prolapse is due to the fact that the elastic connective tissue around the dilated, worn-out veins loses elasticity. Therefore, during evacuation, the hemorrhoids lead out the feces, but at the completion of the evacuation, the sphincters close swiftly and trap them out, because the dilated veins go back slowly due to loss of elasticity. This process is repeated in time and prolapse is created, as can be seen on the right side of the picture. That is, the hemorrhoids and the mucosa lining it tend to remain permanently outside, creating a prolapse that is perceived by the patient, as I said before, as the presence of fleshy formations outside the anus. According to the degree of seriousness of the prolapse, the hemorrhoids are classified as being of first, second, third, and fourth degree. The first distinctive symptom of the hemorrhoids is hemorrhage. It is seldom the case of serious hemorrhages. Only rarely can they cause anemia. Another symptom is the prolapse. There can be pain as well. Hemorrhoids are not usually painful. Pain, instead, is a symptom of anal fissures, as it were, some small cuts on the level of the anal canal, that is, on the level of the mucosa that I told you is highly sensitive to pain. Pain can be present in the hemorrhoidal disease as well, only in case of complications, that is, strangulation and hemorrhoidal thrombosis. Diagnosis is carried out by physical examination, directly seeing the prolapsed veins outside the anal orifice and in the last part of the rectum to feel if there are any pathological lesions. Anoscopy consists in the insertion of a device to see the anal canal and the last part of the rectum where the hemorrhoids can be found. Colonoscopy or enema or virtual colonoscopy are carried out in some cases of bleeding to rule out a far more serious disease, cancer of the rectum or sigma. Medical therapy can improve the symptoms, but it does not cure the disease that resurfaces after one stops taking the tablets or using the cream. Surgical therapy is the solution. This picture shows the traditional mode of operation. Top right, the hemorrhoids can be seen as 3 formations outside the anus. Thus, you can see the performance of the traditional operation, a very painful one, that consists in the excision, that is, cutting out the hemorrhoids and the mucosa lining them with several cuts. 3 cuts are left, as you can see, bottom right in the picture, that are situated just in the anal canal, that is, in the painful area. Such cuts take about 2 months to heal, and every time the faces pass are reopened and are extremely painful. Sadly, this operation is still performed when a patient does not look after himself properly and comes to the surgeon with some very serious 4th-degree prolapses that cannot be dealt with performing some conservative, less painful operations. There are some less traumatic and painful operations that solve the problem, acting on the level of the painless rectum mucosa above the dentate line that was defined as line of pain. What I perfected is here represented and is called the transanal manual hemorrhoidopexis. As can be seen on the right of the picture, the fixed mucosa above the prolapse is stitched once. Then, a continuous suture toward the bottom is carried out with 3 or 4 passages. The thread holds the hemorrhoidal column within its coils. When the ends of the suture are tied, the veins, that is the hemorrhoids, are trapped inside the knot, as can be seen on the left of the picture, and the prolapse is taken back in. One makes a kind of pleat, as tailors do. The stitch is reabsorbed after about 2 months. The scar prevents both the hemorrhoids and the prolapse from recurring. All is carried out with no cuts in the painless rectum mucosa, 1 centimeter above the line of pain. Moreover, it is the safest operation because it's carried out under the eyes of the surgeon, not by a stapler. Such operation does not require any preventive, Doppler-guided tying of the arteries. Another picture portraying my technique. As shown by the arrow on the left, the prolapse containing the dilated hemorrhoidal veins is drawn back in, and the hemorrhoids are trapped within the knotted thread, as can be seen on the right of the picture, at the end of the operation. It is called tailored surgery because the surgeon can make a more marked pleat with 3-4 passages if there is a more marked prolapse, while 2-3 passages are enough if there is a less marked one. Sometimes, in case of some very marked prolapses, a second, higher pleat can be made to help a greater re-entry of the tissue. A very simple technique, hence with hardly any risk. As there is no cut, postoperative pain is very slight. There is a minimal surgical trauma, and there is no possibility of lesion to the sphincters. The suture is under visual control, hence risk-free. Postoperative hemorrhage is rare. Lifting effect is marked, and above all, the diseased hemorrhoids, trapped and pressed within the stitch, disappear. As you can see, I started performing this operation in 1999. In my case files, the success rate is very high if the technique is correctly carried out. Actually, though, in the case of very advanced 4th degrees hemorrhoids, the traditional, painful operation with the cuts must still be performed. Using a conservative technique may lead to failure. To view some intraoperative images of an operation I performed, please check Manual Hemorrhoidopexy on YouTube. Thank you for your kind attention.